You can control this in the Zoom conference room using the mute feature located in the lower left corner of the window. For this call, we're looking for interaction, and there will be several times to ask questions of our panelists during the presentation. Please unmute yourself when you want to talk. Due to the number of attendees and to help us track attendance, please put your name and organization in the chat box so everyone knows who is here. If you're not able to connect by computer, please email your name and organization to guthriemoss@wisc.edu. Okay, next slide, please. This presentation and accompanying materials will be available at a later date on the Health Transition website under the Learning Community tab. At the end of the call today, please complete the evaluation at the link provided in the chat box. If you leave the call early, the link will be sent to you. We would especially appreciate if you could provide possible topics for future Learning Community calls in order of your interest. This helps us continue to provide interesting topics and quality content to our healthcare transition champions like you. Okay, next please. My name is Beth Guthrie Moss. I'm the parent of a 27-year-old who is on the autism spectrum, and I'm also the coordinator for the Youth Health Transition Initiative at the Weizmann Center. Okay, next. Next slide, please. Oh, here we go. We hope you have received the agenda ahead of time. Today, we will hear from 3 youth and 2 family members who will tell their stories of transition and how they are coping with the move from pediatric to adult healthcare. You will also view the debut of 2 of our new transition videos. They will be available along with other videos on our website and at our trainings. So, what will you learn today? Participants attending will be able to identify opportunities before age 18 for conversations with youth and their family about transition to an adult provider. Discuss 2 actions that will assist youth and their families in the transition process. Number 1, generate a list of questions to ask families to help them in the transition process. And 2, provide resources to a family and youth approaching transition age, including the Got Transition website, Health Transition Wisconsin website, Pacer Center, etc. And you will be able to expect that youth will take charge of their own health care. Okay, next. A brief introduction on how we came up with the topics for our panel discussion. While videotaping 5 families whose youth have very different chronic health conditions, one theme stood out. When families were asked if there was anything they wanted to add to their story, they all recounted that a successful experience in a healthcare setting starts with the development and building of a strong, trusting relationship with their provider. They valued the time spent getting to know them as a whole person. So let's get to know our 3 youth patients here today. So as each youth and their family member introduce themselves, they will also talk about how important it is to them to have a trusting relationship with their doctor or practitioner. Okay, Hunter is going to lead us off.
Hello, everybody. My name is Hunter. The person next to me is my father, Tim. I am 22 years old, and I am currently living at my parents' house. I'm currently diagnosed with autism, depression, and high anxiety, and I'm also easy to stress. It really affects mostly my day-to-day life outside of school and outside of home, but overall I am coping with my diagnosis pretty well. and I have a great support group in my dad and his organizations he works for. I'm currently a college student at MATC. I'm also going to MATC for becoming a veterinarian technician later on once I'm done with my current courses. I'm also currently part of a Dungeons and Dragons group here in my hometown. And I am a really big fan of Dungeons and Dragons.
All right, thank you very much, Hunter. All right, now we are going to hear from Noah. Can we have the next slide, please? Noah, could you please introduce yourself? Okay, Noah, you and Kelly are on mute.
All right. My name is Noah. I'm 21. I live at home for now, but someday expects to have his own place. Noah is a huge Twins fan. He loves all sports. He has a brother and he's going to be the best man in his wedding coming up. He loves to watch YouTube videos. There's one in particular, Jenna, who he loves to watch. And he just turned 21, so he has started to enjoy like social hours with friends, not during COVID right now, except for virtually. And so he's started to like beer, and at some point plans on living in Florida. Oh, what else? And my so yeah, and some of the pictures that you see are him at a wedding of a really good friend. He loves to dance. He loves to go to spring training in Florida. And then the picture on the right is him floating in his tube at the cabin.
All right, thank you. And Noah, can you tell us, you just shared with me something that you're doing at UW. Could you share that with us? Okay, you guys are on mute again.
Noah asked if I would share that for him. But every year Noah goes down to a speech pathology and pre-med course and presents a little bit about our life and his dreams and goals and interactions with physicians. And so he just presented a week ago, and now he's going to be a reoccurring Zoom presenter to the class this semester. So we love doing that.
That's excellent. All right. So Noah, I'm going to ask you a question now about healthcare. When I talked with you, you told me that you really liked your doctor. So could you just tell us, kind of get us started on why you like your doctor and why you feel comfortable?
Our doctor. Well, we recently had one of our favorite doctors moved. So we're actually kind of going through another transition, but we loved our doctor because he got to know us, especially Noah. They built a relationship. He knew Noah very personally. So when Noah would come in, he knew he'd ask him about his twins baseball, how that was going. He'd ask him about, you know, Noah delivers Meals on Wheels, how that was going. And he knows Noah hangs out with a lot of UW students. So we'd have those conversations interspersed around the medical reasons that we were there. And it all kind of intersected to give, I think, a much fuller picture of Noah and our household and how best they could make recommendations to help us.
Okay, thank you. Thanks. And Hunter, I'm going to come back and ask you that question too when we get to your telling your story, okay? All right. Okay, let's go to Mary Jane. Mary Jane, could you introduce yourself, please, and just tell us a bit about you?
Yeah, hi, I'm Mary Jane. I am 16 years old. I'm a junior at Memorial High School. I love swimming and I just love like being outside, hanging out with my friends. And this fall, I'm excited. I was talking with Beth about it just a minute ago. I joined the Camp Randall rowing team, so I'm really excited about that. And yeah, is there anything else I should say?
Yeah, can you tell us about your diagnosis and kind of what you do for your health?
Yeah, of course. So I was diagnosed at birth with a genetic disorder called phenylketonuria, or PKU. And basically, it just affects the way that my body breaks down a certain amino acid. And if it's untreated, it can affect your like cognitive function. It can make it harder for you to like think straight, and harder for you to kind of like, I guess, organize your thoughts. So like I said, I was diagnosed as a baby because they have like a test right after birth. And so I've been treated my whole life by taking medications and drinking like a protein formula drink that gives me all the protein that I need. So yeah.
Okay, that's great. Thank you. So Mary Jane, when we were filming the video, we talked about, you know, what does your doctor do to make you feel comfortable? Like, what is it that when you go to the doctor's office, you feel like you can kind of open up and talk with her?
Yeah, so what makes me comfortable at the doctor's office is just when the doctor is, I guess, like a kind of a friendly person, of course, but it's nice to have like a relationship with your doctor, kind of like what Noah and Kelly were talking about, like someone who's interested in your life beyond just like medical reasons, like they're interested in your hobbies and like they know you well beyond just someone that comes to the doctor.
Okay, great. Thank you. All right. Thank you, everyone. That was great. All right. Now we're going to go to Noah and Kelly and give them some more time to tell us their story. And when they're finished kind of with their questions, then you will have an opportunity to ask your own questions, and you can type those into the chat box, raise your hand, or just unmute and ask. So I'm going to start out asking questions, all right? So, and you all just elaborate and say whatever you'd like. All right, so my first question is for Noah. Noah, how do you communicate with your doctor?
Oh, Noah likes to use my chart. And then when we're in the office, Noah speaks directly to the doctor, and we have doctors that are very, very perceptive of his language. And if they don't understand, then my husband or I are there to interpret for him.
Okay, great. And Noah, how does that make you feel when the doctor speaks directly to you?
Noah doesn't have an answer, but I've seen his reactions many, many times. Especially, he always has a lot of questions himself for our doctors. And so he comes prepared with kind of a mindset of what he needs to ask as well. And so, but that one-on-one conversation is always appreciated.
Okay, great. Yeah. Yeah, I know when we were talking before, Noah and Kelly said that it was super important for the doctors to speak to Noah. And Kelly, you're more of an interpreter there during the visit.
As he's grown up, he's making more of his own decisions, and we expect him to do more and more with that. And so he needs to have that communication directly with the doctor, and he can express what he's feeling in better terms than we can.
True. Right. Okay, so this is a question for Kelly. You all see, it's a physiatrist, is that correct? Am I saying it right?
We see a physiatrist.
Physiatrist. I knew I was going to say it wrong.
Yeah, that's
Sorry.
right.
Okay.
Our rehab specialist, yes.
Right. So how does this doctor help your family to manage Noah's healthcare?
So we added this specialty when Noah was about 4. And it is great. It's really an umbrella because we have a lot of specialists that we see. I mean, we have a GI doctor for his G tube. We have an orthopedist. We just have, I could list down, I don't even know how many doctors we have. And we have a pretty extensive history. If you looked at his record in paper. Was I? Sorry? And Noah really likes, he wanted to point out, he likes his orthopedics doctor, Dr. Healy. But this person really is an umbrella. They've known us for a long period of time generally. And so they see kind of the full picture. And we've been able to, in those conversations, we have talked about development through the ages. So when school was in play, we discussed school topics. We talk about home equipment needs. We talk about emotional, behavioral needs, as well as physical needs. And then they are a connection, kind of our, like I said, umbrella to all of our other physicians.
Okay, great. Tell us a little bit about transition. How did Noah, how did you tell your mom that you were ready to transition from pediatrics?
He's being quiet today. He wants me to tell for him.
That's okay.
When Noah was approaching 18, he decided he didn't want to go to the children's hospital anymore. He wanted to start transitioning his physicians and his dentist to adults, and he wanted to go to the big UW or other adult hospitals. So that was really on his radar. Even though as a family, like, we love the providers that we had these extensively long relationships with, it's Noah's decision and we need to respect that. And so we started having conversations with our physicians, and they made recommendations of who may be appropriate to take over, for example, his GI care in the adult digestive center and things like that.
Okay. All right. And Kelly, I know you did some things to help prepare Noah to be a more independent patient, like with making appointments. And can you just share a few things that you did as Noah was approaching 18?
It starts with, we have high expectations. I love your slide because Noah is fully capable of doing everything that he needs to do. He just needs some scaffolding and support. And so we expect he's going to take on more and more responsibilities. And so we started laying the groundwork and having those conversations, and then just kind of step-by-step move. We didn't move all of our providers at one point. And it's also a slow building of those relationships. So we need to get to know them. And then not only is it just a transition, we're finding out, when you turn 18 or 21, but like providers move on. And that is another transition for us. So we need to start rebuilding those relationships. And sometimes that's a challenge. We just had an experience actually yesterday where we have one of our favorite physicians just moved and we're being transitioned to another physician, and very different perspectives on expectations when we walked in the door. And so that was a little reminder to us that not all of our physicians have the same viewpoint of expectations as we do. And so we need to have those conversations early so we're all on the same page.
Okay, great. Thank you. Okay, and this is the last question for Noah. Noah, where do you see yourself in 5 years? What are your dreams?
Well, I'm actually thinking about moving to Minneapolis for he wants to apply for a job at Best Buy World Headquarters. He loves electronics and he would be really good at pricing. And so that's one thing recently that we've been talking about. And I think the one thing with Noah is he's always thinking ahead like that. And we've done some path planning to kind of look at what is his dream, and then how as a family and community and support team, including lots of different people, can we kind of help him make those milestones to move towards those goals. Sorry.
Okay, great. Okay, well, I'm going to open up now to questions. Does anyone have any questions for Kelly and Noah? You can either speak up, or I'm going to check the chat box. Is there anybody? All right. Okay, well, there will be time at the end for questions too. So Kelly and Noah, don't go away. All right. Okay, so our next we're going to, oh, you know what? We do have a question. What are some of the most important services and needs you have when moving to adult care?
Needs and services. I think referrals. And people and our pediatric physicians being tightly tied into the community and understanding what is out there overall. So whether that is kind of traditional like support services, like around like equipment access, or just to like social interaction, just to be really well networked in understanding what is within the community. That's really helpful to us.
Okay, great. Thanks, Kelly. Thank you, Noah. Okay, next we are going to view our first video. Shia will introduce herself and talk about her relationship with her doctor.
My name is LaShia and I live in Madison and I'm 13 years old. My diagnosis is sickle cell anemia. Having sickle cell anemia means to me is that I sometimes can't do everything that normal kids can do. The winter is really bad for me because it's cold outside and it's not good for my lungs. Sometimes I feel a lot of pain when I'm in the hospital. In the summer when I'm feeling good, I like to hang out with my friends. I like to go swimming in our pool. I like to play softball, and I have a softball team. And I like to walk my dog and take him to the dog park. Before COVID, I liked going to the mall with my friends, going out to eat with my friends, but we can't do that now as much. Every month I do blood transfusions, but I don't have to do blood transfusions as much anymore because it's summertime. I go to get my transfusion at the American Family Children's Hospital in day treatment. They know me pretty well in day treatment. They're always taking my thought into suggestion. They're always making sure they do their best. And like it makes me feel more comfortable that I've known them since I was like a little baby. And so it's not just like somebody new that doesn't really know me. My relationship with my doctor is pretty well. I mean, like she listens to me and everything and hears me out. It helps me again feel comfortable that she's known me since I was like little. She knows pretty much about me. She listens to me. She just doesn't just put whatever I'm saying just like over her head, like, oh, whatever. Like she actually takes it into consideration. I learned so much about sickle cell from like listening to my mom talk to the doctors. And whenever I go to my doctors, I'd listen to whatever she's saying. I'd listen to all the nurses because I feel like a lot what they say is important. If my doctor said I want my mom to step out and talk to me alone, I would be kind of iffy about it. I'm kind of nervous maybe. If I would do it, I would just be kind of different because my mom's always been in the room with me. And like my mom's always there to help me understand things more. The best way to communicate with my doctor for me would be talking because I just feel like I would understand it more or if I had any questions. After high school, I want to go to college, but I'm just not sure what I want to do. I just know I want to go to college because I want to have some type of degree. A dream I would have is like I would want to get a bone marrow transplant and like go to like Hawaii. I want to go to the ocean there, and I just want to like go see Hawaii because it looks pretty cool.
All right, we're actually not missing any of Lashia's voice because she's already, the audio and video is a little off. So she has said everything that you're seeing right now. Okay, Becky, I think we can go ahead and maybe stop the video since we can't hear Lashia anymore. All right, thank you. And we're gonna get back to our PowerPoint. All right, so next we are actually going to hear from Mary Jane. And Mary Jane, I have a few questions for you. So if you could take yourself off of mute, that would be great. All right. So Mary Jane, when did you learn about your diagnosis?
Well, I don't know that I remember like the first time I ever learned about it because like I said, I was diagnosed as a baby. So I guess I just kind of always knew about it. But I started learning about it like as soon as I was like old enough to understand what it meant and everything, and like doctors and my parents would explain it to me using like pictures or like different things to make it like easier for a kid to understand.
Okay, great. Thank you. So it was mostly your parents who talked to you about the about your diagnosis, about PKU?
Yeah, my parents and also like my doctors too.
Okay, great. All right. And so Mary Jane, you told us a great story about when you were fairly young and you started to take charge of your own health with your diet. Can you tell us that story?
Yeah. So one of the things about PKU is you're kind of supposed to limit how much protein you're supposed to, like, you can eat in a day. Some people, it varies like on how, I guess, severe their case is, but some people can't eat any protein. I have like a less severe case, so I can eat almost a normal diet. However, when I was about 8 or 9, I started thinking of ways that I could get less protein in my diet because I wanted to make it easier for myself to like just not have to worry about my levels every single month when I did my tests. So I thought of the idea of becoming a vegetarian since meat obviously has a lot of protein in it. So I talked to my parents about it and they thought it was a good idea. So at the next doctor's appointment, I brought it up to my doctor. And I was actually really nervous to talk to my doctor about it because I don't know why. For some reason, I thought she would be mad at me. But of course, it was fine. And everyone was proud of me, I think, for taking charge. And I've been a vegetarian ever since then, and I'll probably be a vegetarian for the rest of my life.
Okay, great. That's great. That's a great story. So tell us about the first time that your doctor asked if she could see you alone.
I think I was about maybe like 13 or maybe 14. And I think I recall being like a little bit nervous because I didn't want to be alone without my mom. And sometimes when I'm at the doctor's office, even now, when the doctor asks a question, if I don't know the answer, I just look at my mom and then she answers it for me. So I wasn't quite sure how that was going to work if my mom wasn't there. Um, and I was kind of scared that the doctors would like be mad at me for some reason. But of course, it was fine. And the doctors were really friendly. And they told me that the reason why they were doing it was like for my safety. And if I wanted to like say anything that I didn't feel comfortable saying in front of my mom or my parents. And so I guess now it just kind of makes me feel good that they do that because I know if I ever need to tell the doctor something, I always have that opportunity.
Yeah, okay, great. So can you kind of think about what maybe someone could have said to you so that you weren't so surprised when that happened? And so you didn't think you were in trouble?
Yeah, I guess they could have. I mean, I don't really remember if they explained it or not, but I feel like they could have maybe done a better job of explaining like exactly what's going to happen when my mom left because I think they just said like, "Oh, like we're going to talk to you alone now. So your mom can leave the room or whatever." It would have been nice if they would have said something like, "Oh, like we want to give you this time in case you have anything that you'd like to say like for your safety or that you don't want to talk about with your parents." So I don't know, maybe they did do that, but if they did, I definitely don't really remember. So yeah.
Okay, okay, good, thank you. So tell us about your relationship with your doctor, and do you think you'll be ready to transition to an adult doctor when the time comes?
Um, well, yeah, I have a good relationship with my pediatrician right now. She's also my sister's pediatrician, so she knows our family pretty well, and we've been with her ever since we lived in Madison. So I really like her, yeah. But I think that when I become an adult, I think I'll be ready to move on because I'm surrounded by a lot of really supportive people that will have resources for me and give me lots of options to find another doctor that works for me.
Okay, great. Thanks. Thanks, Mary Jane. All right. So does anyone have any questions for Mary Jane? In the chat box, or you can talk aloud. Anybody? Kelly, do you and Noah have a question? Are you chatting? All
I
right.
was just interested where Mary Jane lived before.
Oh, I was born in Lincoln, Nebraska. We moved here when I was like 2, so I barely lived there.
Okay, great. Yeah, good question. All right. Okay, thank you, Mary Jane. And now we are going to go to our second video. This is Elise. She's actually Lashia's mom. She's going to introduce herself and talk about transition and her 2 teens.
My name is Elise, and I have 2 kids that have sickle cell, Shia and Terrell. Terrell is 19 and Shia is 13, and they are complete opposites with their sickle cell. Terrell is sick a lot. He has a GJ tube, and he does electrophoresis, and Shia just does monthly blood transfusions. Starting around 15 or so, we have sickle cell clinic, and it's usually twice a year. And they would take the teenagers off, and he would meet with like the social worker, and then need to do is like, do you all know what medicines you take? Do you know who your doctor is? Do you know how to do your refills? Some of the kids didn't know their medicines, and the doctors really started trying to push the kids to let them know that these are really important things that you all need to start taking care of. Terrell got into a situation where I needed to call and try to get some things done for him, and I couldn't because he was 18 years of age, and the situation where he was in, he couldn't do it for himself, and it was actually really bad. I could not get my son's medicine he needed. I could not talk to the doctors. He has a GJ tube. I couldn't get the formula that he needed. I couldn't get anything until I could get this consent form signed by my son. Thank God there's a really good social worker that he has, and she worked with me to get it signed to then get him the medical care that he needed. But I just felt like it kind of fell through the cracks, and I actually know a lot. I've advocated a lot for him, and I think they just assumed that I had already done that, and I actually just kind of forgot to get the form signed by him. It was brought up to us, it was, but it just wasn't like on the forefront. And then when the situation happened, I didn't have anything. We were not prepared. Some advocacy needs to really be done more for kids before they turn 18. So I think this is something that actually needs to be addressed at doctor's appointments, or when they're talking to the social worker, that they explain to these kids what it is that they're signing and why they're signing it. It's just so doctors can still talk to their parents if they want to help them make medical appointments still to get medication, because we're not taking away any of his rights. So they have the right to put an end date, and then if it expires and they still need their parents' help, then they can, just re-sign a consent form, because once they turn 18, you have no more rights anymore. And basically, he was out of luck, and I could not help him. And thankfully, the social worker really helped me to try to scramble and get things done for him. I went to actually all of Terrell's appointments, and then like if they did physical, whatever, I just, for his own privacy, I would step out of the room because he wanted it to be private. 13, I think, was Terrell's age, around 13 or 14, I think, when the doctor asked me to leave the room. At first, I was like, nope, absolutely not. I told him they don't have that right. No way, this is my child. You aren't going to ask my child anything that I don't want you to ask him, and I have that legal right. But then I was like, whatever. Terrell told me everything they asked him, so I was like, oh, okay. Terrell was like, I don't care. So now that it's Shia, now I'm kind of like, oh, okay. I'm comfortable with them asking her questions. I'm very proud that Terrell graduated high school. High school is very hard for Terrell. We had to do homebound a couple times when he got his GJ tube. He was out of school a lot because of his illness. My dream for Terrell's future is that he figures out what he wants to do in life, that he can, if he wants to, go to college, and that he actually finds a mate that understands sickle cell. My dream for Shia for her future is she actually becomes like a sickle cell advocate. She is very, very good at it. She has a passion. So my dream is that she becomes like a motivational speaker or something like that, I think, for sickle cell.
All right, thank you. And thanks, Becky. I apologize for the audio and video not being synced. That is something that we're going to need to work on, obviously. All right, so there was one question for Mary Jane. Mary Jane, can you unmute for just a moment? Someone has asked if you have a relationship with your school nurse.
No, I don't really know my school nurse at all.
Okay, thanks. Okay, so now it is time for us to move on to Hunter and Tim. They're going to tell their story, and I'm going to start out with a question for Hunter, and I think they're going to kind of chat to each other and talk about Hunter's transition experience. So my first question, Hunter, when did you start seeing your adult doctor?
Well, I believe I started seeing him around my mid-teenage years, but I will defer to my dad for the full story on that.
It was actually around the mid-teenage years, as I had approached his pediatrician and said, you know, with this appointment, I'd really like Hunter to spend a little bit of time alone with you so that he gets to know who you are, so you get to know who Hunter is, because it was really important to me that Hunter sees that the doctor is his doctor, not someone, because like somebody said earlier, up to this point, it was like the doctor would even ask him a question and Hunter would just look at me and I would then answer the question. And so I really wanted to try to get that relationship with his doctor going. So I said, hey, you know, just part of this appointment, I'm just going to step out in the hallway so that you have a little bit of time to just talk to Hunter alone. His response was, well, why do you want to do that? And that's when I started to wonder whether we were ready for transition and if we had the right doctors in place for him to become an adult in charge of his own healthcare. I, of course, asked Hunter the same question, and he had the same answer as the doctor. Why wouldn't we want to do that? So I explained to both of them the purpose for it. But shortly thereafter, I then had in my own appointment, and I brought Hunter with me and introduced him to my primary care doctor. And they got along well, and Hunter liked him. And so we went ahead and transferred the care over. And he started to see the adult doctor since then. It's worked out really well for us. In the beginning, I would go with him to the appointment. And now I'm lucky if he tells me when his appointment is he just goes along. So that scaffolding idea is we work toward that. Do you remember the first time that you met, doctor?
I believe possibly alone or with you first time around.
First time around with me.
First time possibly around 17, I believe, maybe.
And what'd you think of him?
I loved him. The doctor instantly knew what I wanted to talk about, and we just really just hit it off as if we knew each other from the very beginning, as if we've been seeing each other for years, instead of just meeting for a few hours with my dad and everything in the room. We just clicked as doctor to patient.
And now I don't even go with you.
Nope. And as he said, he is very lucky if I even tell him I'm going to see the doctor.
Absolutely. Now, you didn't start just all of a sudden making your own appointments. Do you remember how we
No.
helped you?
Yeah. Early on, it was mostly them starting with setting up appointments, but I slowly grew into setting up my own appointments with my parents' help. Sometimes they even made a few phone calls for me because early on, again, I just didn't like making my own phone calls. So it was them helping out building said bridges to me being independent to do so. And now I'm doing it all by myself with very little input from my parents.
So back in the day, before my chart, it was all about the phone calls. And so we would call the scheduler together, put the phone on speaker, and Hunter was able to do as much as he could, but I was right there if he got stuck. So it took a little bit of worry, a little bit of the anxiety out of it to let him start to build that relationship with even the schedulers, with learning how to make those appointments. What is he asking for? What's he seeing the doctor for? So that we were right there in the beginning to try to help him along so that we knew eventually we wanted him to do it all himself. It worked out so well, and then my chart came around, and now he just does everything online, so I have no idea what's going on. But that scaffolding, that teaching him to do stuff on his own, really surprised us at one point. As me and my wife were just sitting around, and Hunter had learned to drive by this point, so he's probably 17, 18 years old, and we're like, well, where are you going? Knowing he didn't have anywhere that he was supposed to go. He's like, well, I'm going to go see my nutritionist.
Yep.
And we're like, you don't have a nutritionist, Hunter. We've never introduced you to a nutritionist. I didn't know you knew what a nutritionist was. And he explained that you explain how you got a nutritionist.
Well, I basically talked to my primary doctor saying that I was worried about my weight. I didn't feel like I was in my correct weight group at that age and everything. And they recommended that I go see a nutritionist. So I set it up personally by myself and never told my parents. So I explained to them why I was seeing a nutritionist and how I was hoping the nutritionist would help, and they really did help. I've been continuing to eating better. I've restarted working out actually as well. So I'm doing that even more. So I am focusing on my personal health and weight. So the nutritionist really did help, and I am thankful that I set it up and everything. And I'm also really proud that I did it independently without my parents' input.
The other thing you've started to do independently too is you don't have a lot of medication. You don't take a lot of medications right now, but you do try to take a lot of supplements and vitamins.
Yep.
Again, for weight issues and to try to build everything up. How do you independently because you have a number. I don't even know what you do. How do you figure out when you're supposed to take what and keep it all together? Because I don't do any of that.
I mostly just take my multivitamin at the beginning of the day, either at breakfast or at lunch, and then either lunch or dinner, I take the vitamin B, vitamin C, and vitamin D pills and everything with the meals and everything. That way I get the full effect of both a pill and a good meal.
How do you remember to take them?
I just do my best to remember.
So do you have a line of jars somewhere that you just go and pick through, or how do you organize?
Well, my mom pulled out the day-to-day Sunday through Saturday pill thing that a lot of elderly people use to keep their prescriptions in line, more or less.
Elderly people like me.
Yes. But it's mostly just been all right. So today is Thursday. I have to take my multivitamin and my vitamin B, my vitamin D, and my vitamin C pills today. So let's make sure I do so, and I did.
So she started out filling your pill containers.
Yep, and now I'm doing it independently if I remember to do so. I still forget on that.
but now it's you who are responsible for making sure that the pills are there and they get into the box. And, again, that whole sense of independence. We want him to be able to learn these skills so that if you ever get out of my basement, which you don't have to leave, but someday if you want to, you're more than welcome to. One day, you'll be able to handle all this stuff on your own. So to close up, just tell us a little bit about, do you remember how you ended up with you said you were going to Madison College?
Correct.
So what is it you want to do?
I want to be a veterinarian technician.
That of course is because we've exposed you to pets your entire life.
Oh my gosh, yes.
No, we have not.
Well, our neighborhood has.
Okay, our neighborhood has, but you didn't grow up with pets.
Nope.
And then all of a sudden you go to college, and how did you decide on veterinary technician?
I've just always felt more connected to animals and to nature than I do my fellow man and everything, despite how well me and my doctor clicked on our first meeting and everything. Again, I just feel more in tune when I'm near animals or I'm out in nature and everything. So that's why I decided to be a veterinarian technician, is to be closely more related to animals and everything. Learn how they work and how to help them, to give back a little bit of my time to this amazing world we call home.
Not going back to college wasn't an easy choice. I mean, it wasn't like high school was all fun and roses.
Yeah, no, it was definitely not, seeing how I was online taught, so that might have a bit of problematic situations with my social life. But then again, I never really had one doing elementary school in the first place.
Another area that parents look back and say, well, maybe we could have done a little bit better, but
A little bit?
I can't change it now. So
I
it's up
wish
to
we
you.
invented time machines.
Okay, I'm sorry that we didn't give you the social experiences that could have helped you. We have a question about telehealth. Have you ever done telehealth with your doctor yet?
Ironically enough, no.
Oh, how would you feel about that?
I would be open to trying it.
Okay. Anything else you want to tell us about your healthcare, your doctor, your GPS, whatever?
Overall, I think GPS is a godsend alongside my chart and everything. I am trying to learn how to understand driving in Madison, but it's Madison. The streets are more confusing than the current political situation in America. And yes, I am someone who does a lot of gallows humor, so expect a few jokes here and there.
All right, anything else?
No, that really much sums up everything.
All right, well, that's us. Thanks, Beth.
All
Yeah,
right.
thanks, Beth.
Thank you very much. You covered pretty much all my questions with your conversation. Thanks, I appreciate that. So are there any other questions for Hunter and Tim? I do have one here, and I guess this is for everybody. Has anyone had difficulty finding adult specialty providers who are familiar with childhood diagnoses? For Kelly or Tim, maybe?
I would say we've had trouble with dentistry, so that's not necessarily medical, but definitely dentistry and orthodontics.
Okay. And I think Mary Jane, I believe that your mom and you told me that you can stay at the Wiseman Center through adulthood. Is that correct?
Yeah, that's correct.
Okay, so you'll be looking for maybe a primary care doctor who knows about PKU, but your actual specialists you can stay with. So that's really good for you. That'll be great. How about you, Tim and Hunter?
Well, we were just discussing that a lot of Hunter's especially needs around anxiety, depression, and then his autism really came out with young adulthood. Was when we started to really have some challenges. Hunter, as a matter of fact, you went as adult to get diagnosed, because we would try diagnosis as kids, and they were never able to really nail down what was going on.
No, I wasn't fully diagnosed with autism till 20 and everything. So that was a fun adventure trying to see my parents jump from different medical professionals in the field of mental disabilities to another one as I progressed in age until we just found one that was like, yeah, you're autistic.
And so your primary care doctor has always been there.
Yep.
When you were diagnosed with autism. He's part of your team.
Yep. And a good support team and medical personnel is definitely a good idea to have.
All right, thank you very much. All right, let's see. Now we are
I
going.
think Kelly might be wanting to interject.
Sorry, I
Sure. I wanted to add something to the specialty conversation. Because we live in Madison now, but we had lived in a rural community when Noah was very young, and that posed really significant challenges. Like we had to travel 1 hour one way to get to a pediatric physical therapist, or other specialists we had to travel to Madison or Milwaukee. So statewide, I think there's lots of challenges in finding specialists. So I just want to follow up with that.
Okay, thank you, Kelly. All right. Now let's see, we are going to move on to, so does anyone have any other questions for the panelists? Okay, oh, we do have a question about articles on Gen Z, which is what the generation you all are. And I don't have any articles myself, but I can certainly look around and in the follow-up emails, send those out to everyone who participated today. Okay, and we do have one, let's see, we've only got 3 more minutes. So I'd like to share some of the resources. We have one more question, but I will actually ask Mary Jane that separately. And also the group. So, all right, so we do have resources, some great resources that you can access from our website or by emailing me. My email is in the chat box. If it's not there, I'll put it there at the end. These are resources both for you and your practice and to share with youth, families, and caregivers. And let's see, yeah, there we are. All right, our Stay a Step Ahead brochure and health pocket guide are available to download and in hard copy. The brochure serves as a reminder to get started early and be sure to cover all the bases by age 18. And the health pocket guide is a nice tool for youth to fill out and take to their appointments. The Youth Health Transition Initiative also offers the Build Your Bridge training through the regional centers and the adaptable Bridging the Gap training. We also have a newly developed Closing the Gap set of presentations for practitioners. So I'm wondering if anyone in the group has any resources to share. You can throw those up in the chat box. It would be great for everyone, and I can collect those and send those along with the follow-up email as well. So moving on to the national resource, this GOT Transition is the national resource that we use as a foundation for our materials and training. The Transition Readiness Assessment for parents and caregivers is a good tool to share early on so families can see where they are in the transition process. The GOT Transition website has extensive information about the 6 core elements, which is a widely adopted approach to transition for practitioners. So now that our presentation is complete, we are at 1 o'clock. I'd like for you to just quickly think back to our goal of generating a list of questions to ask families to help them in the transition process. So please think of a question you could ask and type it in the chat box to share with the group. And I'll send those ideas as well in the follow-up email so that everyone can benefit. And I just want to let you know that we have A lot of thank yous for our panelists. Family Voices has transition resources with its What's After High School training. You can find that at Family Voices, Family Voices WI, all one word, .org. Another thank you to our panelists. Thank you for your time. We really appreciate your insights and your stories. And we have completed the goals for this learning community. Please complete the evaluation. Lynn has put the link up several times, and we sure appreciate if you could go to that survey, quick survey, and do that for us. Our next call is November 19th. We will be sending out details to our listserv, and those will also be on the website. Thank you very much, everyone, for your participation, and this concludes our presentation.